Autonomic dysreflexia is a serious health condition that is not uncommon for individuals with a spinal cord injury at level T6 or higher. It is sometimes called autonomic hyperreflexia, but more commonly known in the physical therapy community as autonomic dysreflexia. It is life-threatening and is more commonly found in individuals with a complete spinal cord injury. So somebody who's more on the Asia scale A, although you do see it in Asia scale Bs and sometimes in Cs. The important thing to know is this is a medical emergency. That is life-threatening and something you need to act on fast if you're suspecting it, or if your client, who may very well know they're having this event occurring, say, I think I'm having autonomic dysreflexia. There could be many reasons why they're having this condition, this life-threatening condition. It could be related to a urinary tract infection, fecal impaction, or not having a bowel movement, being incredibly constipated. It could be from an irritant from a pressure sore, catheter irritation, kink catheter, being hyperstretched on the hamstrings, restrictive clothing, restrictive catheter bag, strap or bag on the leg, IV lines. So there could be many reasons. So what do you do right away? You contact 911, right? You get help. You get somebody helping you. If you're stuck alone in the community with someone with autonomic dysreflexia, you call 911. Then your immediate reaction is you see if there is something that you can do to relieve the stimuli or the catalyst for this problem, which, as I mentioned earlier, and you can reference page 359 in UMFRED, that kink catheter, that could be something, a real restricted tight clothing around the in the pants area, right? So if you can change that, or certainly if you're stretching somebody, stop stretching them, or get them in a position right away in long sitting. So if they're laying down flat, you get them in long sitting. You sit them up. And why do you do this? Because primarily it's blood pressure. The high blood pressure can cause a stroke. The high blood pressure can signal other things, events going on in the body, which do not have a good outcome. Heart failure. There's things that can happen, a head injury from this type of event. So you want to get that person upright. Certainly call 911, get help right away if you're in a care facility where there's other people, hospital, acute care, long-term care, the home. And you have these symptoms that are listed. I think it's important that you're monitoring blood pressure, that the catalyst with this, or the signal event, is that elevated and high blood pressure. That is the tell-all sign that something is wrong. It's not low blood pressure, it's high blood pressure, and often incredibly high blood pressure. We're talking numbers of 200 over 120, or higher than that in terms of systolic and diastolic. It could be all types of symptoms or none of the below, the high blood pressure being present, but they may or may not have a severe headache. They may or may not have goosebumps, chills. They could have all of these. Blurred vision, may or may not have this. Flushing or blotching of skin, like someone who's embarrassed, right? Or someone that's been partially in the sun. That would be kind of blotchy skin. Fast heart rate or low heart rate. Stuffy nose, congested, vasodilation above the level of injury, And perhaps, as I said before, minimal no symptoms besides that high blood pressure, and cardiac arrhythmia, perhaps, right? Possibly ingrowing toenail could be the catalyst for that. I don't expect you to be certainly digging around looking, clipping toenails in some kind of medical emergency, but if someone's out in the sun, you get them out of the sun, and that's what you do to hopefully mitigate what's that medical event that's happening. Okay, so I think I covered it all, what you do. Get them in a seated position. If you can put them on a cushion or something that's soft, it's better than putting them on something that's hard, which could actually be worsening the situation if the catalyst is, for example, a bed sore, or someone that's in a position too long, or if it's on a kinked catheter that's getting more kinked when they are on a more firm surface. And there you go. Get help right away, medical emergency.